Good evening. Welcome to another episode of Health Digest with me, Dr. Mercy Korir. And tonight we are looking at one of the pillars towards universal health care coverage, and that is the access to health facilities. Now, a report by the International Rescue Committee in 2015 found out that only 63% of Kenyans live within an hour of a health facility. Now, in other areas like Turkana, for example, it may even take 2 days to reach a health facility. This has a direct impact on the health indicators in those regions. To start off this discussion, I bring you one of those hard-to-reach areas, and this is Remba Island in Lake Victoria, and that's Homa Bay County. And we visited the island, which may take 6 to 8 hours to reach, depending on the weather condition and the state of the lake. Let's take a look at that story. The angry waves begin to tell what will be a rough journey in my attempts to travel through a journey that a health provider or client would take to Remba Island. There's almost no time to settle in the vessel as huge tides collide, producing waves upon waves that throw the boat up in the air, leaving its contents, us, gasping for air and scrambling to hold on. Today is our lucky day. We have what is supposed to be a fast boat, which cuts our journey by half. Still, with no cover, we are not sheltered from the rain or from the waves meters high, neither from the tortuous journey. Now, that's just a sneak peek at what we went through to access Remba Island. And mark you, we had a speedboat, what is called a speedboat, which is a motorboat that took us half that hour and half the time that it takes for that journey, and that was 3 hours. Now, to help us have a discussion on this far-to-reach areas and what health workers go through and even their clients in accessing health facilities, I have 3 of my panelists who work primarily in South Nyanza, and we'll be able to discuss and look at this discussion in detail. To my immediate left is Robert Aseda. Aseda is a policy officer with NAYA. NAYA is the Network for Adolescents and Youth of Africa. Next to him is Evelyn Ajuang, who is a public health nurse with Omega Foundation. And last but not least is Aaga Mitoko, who is a clinical officer at Matibabu Foundation. And I'll start with Evelyn. You have seen that journey. You probably have taken that journey in going to one of the islands to provide health facilities. Is this the case on a day-to-day basis?
Thanks, Mercy. Omega Foundation implements its program in Mageta Highland, where we support both private and government facilities with sexual reproductive health services. And this is not different at Mageta, where we service providers still use the same transportation, which it's a challenge both to the service provider and the client, in that in the service delivery, several locations you might get cases of referrals that you intend to refer a client to a higher level. And sometimes there's just one type of transport, which either the boat or the ferry. Like in Mageta, we have the water bus, which is there. But they have timings. So in a scenario where you get a mother who is in an emergency scenario, and the kind of transport is rare, then the nurse get difficulty in terms of implementing quality, because at the end of the day, for you to be sure that you've implemented quality services, you need to ensure that this client get the service that the client needs. So means of transportation is a challenge to our service providers and also to the clients themselves at the facility, at the various highlands in the southwest Kenya.
And we note that the only way to access these islands, whether it's going there or going out of there, is through the water. Has there been any efforts to just make it any different? Like, I know we'll look at the story of Mageta, but is there any efforts to make it any different and any better for people who live in those islands, or even for the healthcare workers who have to go to those islands to offer services?
I don't see any improvement in terms of transportation, because it has been water transportation since then. Because also, if you look at Mageta, the way it's situated, there could be no roads that could link the Mageta to the plainlands. It's mostly water area. So the only transport they might use is that transport for water. What needs to be done is either to engage either the policymakers so that they can be able to improve the transportation services, in that the clans should be engaged to be aware. Whenever there's an emergency in the community, they can also be aware of the availability of these services so that we can limit the excesses in terms of deaths that occur as a result of lack of that lateness in transportation to another level.
Okay.
Yeah.
Aaga, you also work in South Nyanza or Southwest Nyanza, the same region where we have seen Remba Island. Are these challenges there on a day-to-day basis? At least you on the mainland, do you experience these challenges in accessing facilities or in accessing the community to offer them services?
Yes, Mercy, I think we get a lot of challenges, even in the mainland, apart from the islands. Because when we talk about, we talk about healthcare services, we look at emergency. When we look at emergency, we need to consider access, we need to consider time, we need to consider availability of resources. Right now, as it rains, most parts of the area, especially in Kisumu, are flooded and roads are impassable, and getting a mother who probably needs to deliver in the nearest hospital to access that facility becomes very difficult. Apart from that, when we go to lower level facilities, getting adequate equipment to attend to these mothers is difficult. Getting healthcare providers at a higher level to support them is again difficult. And therefore, the whole setup of talking about maternal mortality and how we can reduce them, we have to look into access. We have to ensure that there are adequate roads. We have to equip the facilities, and we also need to educate the community to understand. I've basically talked about the difficulties, but the county governments in these regions are trying also to mitigate these problems. We have motorcycle ambulances that were introduced by the county government of Siaya so that they can quickly reach to women within the areas that are difficult to access. We also have the ambulances themselves by the county governments in the region to reach out to these mothers and bring them to the hospital or due to emergencies. Okay. We have also seen programs that gives community health volunteers motorcycles that they use to reach to the clients in the community. We have also seen efforts by the government to ensure that the community health workers have access to some common drugs like malaria drugs that they can reach to with these clients in the community before they reach to the facilities.
Okay, and I want to bring in Aseda here from a NAIA perspective. Is what they are talking about in Southwest Nyanza the same thing that you experience on a global scale?
I think globally, the issue of access to services is a very big thing. And I would speak, for example, on issues of young people, for example, who are not able to access services. There are indeed those people who are not able to access services because of the physical proximity to these facilities. However, there are also those people who can't access services, which may be available, but they cannot be able to access them either because of cultural norms, because of social norms, because of individual reasons, because of the way the facilities are in the way they are. So I think the issues of access, inadequate access to health services is indeed a very major issue. If you look at the Adolescent Sexual and Reproductive Health Policy of 2015 and its guidelines, it recognizes that indeed there are vulnerable groups and marginalized groups who are not able to access services. Areas around southwestern Kenya where people cannot access because of infrastructural networks that are not well placed is indeed one, but there are also other categories of other groups of people who are not able to access the services and have therefore been classified as marginalized and vulnerable groups.
Okay, when you talk about infrastructural challenges in these areas, is it because they are hard to reach areas or difficult to reach areas, meaning that even in terms of being prioritized to develop the infrastructure, to equip these areas, it is a bit difficult even for the decision makers?
The first thing is that even before the onset of devolution, there were places that had not seen, let's say, a policy maker per se. But then if you look at the shift to devolution, for example, for the very first time, people have their members of county assembly there, and they can be able to tell them that, hey, this road is an important need, this water transport is connecting us, and they are able to demonstrate the relationship between other development spheres and health. Because health relies heavily on other sectors as well. For example, if the roads are not well maintained, then it's difficult to access the services. And I will give you an example of, for example, in Kajiado County, there is an area that for you to be able to access there, the road itself is quite impassable. So we are looking at situations whereby different regions have different issues that limit their access to these facilities. There could be roads that are impassable during seasons like now when it is raining. There are areas whereby they literally don't have roads, and therefore it is important that you use different approaches to get them. So the issue of even the approach of getting to these people is another issue that could make other people be less likely to access certain key services, which is a fundamental right.
Marginalizing them in the long run. Now, Evelyn, are these facilities, by virtue of them being in a difficult or hard-to-reach areas, are they less equipped, less stocked, less resourced because of that challenge in just accessing them, therefore making it difficult even for health workers, let's say if they live within the same place, to offer services that they should offer?
Yeah, just to bring about quality of service delivery, this impacts on all service delivery areas, whether in the highland or the plainland. When you look at the quality service delivery, where you talk of the supplies, equipments, the knowledge of the staff, issues of leadership and governance, issues of health financing, it cuts across. Yeah, so it's affecting most of our health service delivery. But bringing it back to the island area in terms of the aspect of service delivery, you find that these are areas that are hard to live in. These are areas where electricity is a challenge, water is a challenge, housing a challenge. So you want to enable a healthcare worker to stay in such a scenario. This is already a demotivated person because the environment itself is not conducive for even her to even stay. And in fact, if the healthcare worker is having kids there, where to learn? These are areas that are really underdeveloped. This quality of education is wanting. Illiteracy is also high. Poverty is also a scenario here. So generally, in these island areas, is a challenge because issues of financing has been a challenge from the national level, health financing. So whenever it's devolved into the county, that problem still trickles down to the county level, whereby now the health facilities will be receiving something which is meager, that cannot be able to support them to scale up. So definitely you'll find issues of stockouts, of supplies, whereby a client comes for a service, but at the end of the day, the client sometimes cannot be able to get the service because there's this lack of supplies. Again, it could be issues of transportation because these people get supplies from either the sub-county level or from KEMSA. So if issue of transportation, like now it's raining, sometimes maybe a facility ordered commodities to be taken to the facility, but due to this the climate, then it could be either sometimes impossible or for those medication to be transported. Another thing is human resource for health. There's understaffing, cutting across, both at the other facilities like the islands, yeah? So you get an island whereby it's a health center. A health center basically should have at least 6 to 8 staffs to manage the population there, yeah? But you get a facility having 2 staffs, and these 2 staffs, you need to observe the maternity, you need to observe the outpatient, you're also in the maternal child health clinic, you're observing everywhere, meaning this is somebody who is overworked, and there's issues of burnouts here. So even quality service delivery will go down. So there's a lot that you need to look at in terms of access, because this can also hinder access Because when there is burnout, definitely the provider will not be able to offer more services to the clients. Yeah.
Okay. Aaga, well, from what Evelyn has explained, the area being underdeveloped and therefore affecting resources that are being channeled to those areas. As a health provider, as a clinical officer, or working in the field of providing health, what then are your options? Because if a mother comes with an emergency and they need services, they need help, she has to be helped. What then do you do as a healthcare provider?
Thank you very much for that insight, Mercy. When we look at the broader picture, I want to bring it maybe from the view of NASA, the National Aeronautic Agency, the one for US, not the NASA for Kenya. They send their teams to the space.
The space agency.
The space agency.
Yes,
they
the
send
US.
it to the space. And these people have to live in the space for a long period of time. And when living in the space, they have to get medical services. They have to get engineering services for the spacecraft they're using. So just like the healthcare system, the difficulties, how do they go about the difficulties? For example, they do what we call task shifting. And that's a major thing in trying to solve this issue. They will get a non-medical person, train them on medical issue so that when they go into the space, they are able to help. They send them with ultrasounds that they can take pictures and send back on the ground, and they discuss what I will call telemedicine. So in the areas where we work, one of the key things that we are trying to work on to improve access to health as providers is task shifting. We train traditional birth attendants on how to refer and how to identify emergencies and refer to the facilities so that they get services. We train community health care providers to move door to door, detect diseases early, and send them to facilities at appropriate time so that we support them. That is basically on task shifting. We also have other cadre within the health facilities that are also trained that can assist you even if you are alone and you have to do a delivery. They will help you to conduct the delivery safely so that the mothers are safe. The second thing that is coming handy is telemedicine. As we network with most of the facilities, there is always a consultation both from the village and the facility to identify. In some situations, it is forced. If the patient cannot get a means to come to the facility, we, the clinical officer or the providers, will have to reach out to the client in the community to support them. So we have what we call community programs. Then the other thing that is coming that has not taken root very well is the use of ultrasound by community health volunteers. A good number of there are programs that have trained them to use so that when mothers have problems at home, they can take an ultrasound which can be sent to the facility, and whoever is there, nurses, doctors, or the clinical officers can look into it and support. So, but at the policy level, we also work with the county government. I think one of the best things that the county government has ever done was to bring on the ambulances per sub-county and have a contact person that a referral can be detected very easily. You call the ambulance where possible and refer. So those are some of the mitigation factors that we have. But again, you look at a broader picture, we go into places like the Turkana area where we have the camel clinics, where there are programs that move with the camels, reach into the manyatas, and support the community to access health services. We have had places like Ahiti, where we have the water ambulances, where there's just a boat, full package with everything, and they move along into the islands and support the communities living in the islands where there are no access to facilities, where people have never seen a doctor or a clinical officer or a nurse. They have even never had such people exist. So when you talk of places like Remba, you will get people like that. We have several islands like Migingo, which is just a rock, and there is no facility there. You will have a community service or an ambulance that can go there once or twice in a week, reach the people with the services, and then maybe come back or get into another island.
Okay.
Those are dream ways that we can do and make our healthcare system better. And otherwise, when we talk about hard to reach, the hard to reach is a very big word that means it will define so many things. It is not just a matter of walking and reaching there. You may as well reach there and miss what you want. You may be at a point in a community and you don't even have money to reach to that point of service. Or you may reach there and there is no service providers.
Service providers. And
Yes.
I want to ask Robert, Aaga has really gone into detail about how they are mitigating when it comes to, mainly he has dwelt on maternal and child health, that is reproductive health. Are these the only services that are prioritized in those hard-to-reach areas in terms of healthcare, or are there other aspects of health service provision that are being prioritized in those areas?
Indeed, there are other aspects of health services. You know, when you define health, it refers to that complete well-being. So there are so many issues under health. But apart from issues of maternal health care, for example, which are very important, there are issues of access to, for example, reproductive health services. There are the issues of immunization. There are issues of even just a person who comes to the hospital because they have this headache that refuses to go away. So indeed, there are other services that are also critically important to that as well. But Aaga mentioned something that I would also like to add on in terms of the ways of trying to reach the hard-to-reach population. And he has said that indeed there is no group that you can say this group is hard to reach. I mean, there is no particular definition for hard to reach. There are so many clusters of people who can be able to fall into this group. And that is why it is important that whenever programs are being designed, whenever healthcare is being provided, that the specific group of people are looked at. Because what can work in Remba Island, for example,
May
is
not work in another
what will
place.
work in another place.
Okay.
So it's important to be able to look at the approach that works, and if possible, to look at best ways of providing these services in an integrated manner. Okay. Currently, for example, within the guidelines for provision of youth-friendly services, they have proposed models, 4 models. So we have the clinic model that you go to a facility and then you get the services that you want. But then they've also introduced, for example, the school-based model, where within the school setup, for example, there could be services that could be provided or information that could be provided that could then augment what is being done in the clinic-based model. Okay. So the other model is also the community-based model, because the community has these places where they could be youth centers, they could be clubs that have been organized within the community, and the Ministry of Health or any other partner that is providing these health services could be able to ride on the existing facilities and the existing work that they're doing to be able to provide services. And of course, there are areas that, for example, have access to internet. These areas could use the virtual-based model, whereby partners and again the Ministry of Health could partner to be able to provide tailored services for these people. All
right. We'll take a break from that note, by I said, and when we come back, we look at the issues of staffing, specifically in those hard-to-reach areas, and we'll discuss also a bit about devolving healthcare and if it has been of any benefit to these areas that are difficult to access to provide healthcare services. Stay with us.